welcome back to Over 55. I'd like to introduce our next guest, which is Alex Hanham, president of Medpoint. Hello, Alex. How are you doing?
Pleased to be here.
Maybe you can explain who and what Medpoint is.
Medpoint is a public-private hybrid. We're a preventative healthcare center. We focus on a 3-hour medical that screens for cancer, diabetes, and heart disease. And we also have a membership program, which is year-round comprehensive healthcare. And we also have, so that's one of our main divisions. We have actually about 4 divisions. The other division is we have a personal training studio, which has 5 kinesiologists working out of there doing one-on-one personal training. We have a nutrition division. We also have a specialist division, so we have 2 cardiologists, a dermatologist, a surgeon, we have a psychiatrist and an internal medicine doctor, and we just signed on a rheumatologist. And then the last component we have is a walk-in clinic and women's health services, and that's a sort of like a walk-in clinic, but it's a same-day clinic. You can actually make an appointment and see a doctor at a certain time.
That's incredible. So it's like OHIP with the bonus of these extra services. If it's a fee, people look through the OHIP payment schedule, and I guess that's covered by OHIP?
Yeah, all our physicians bill OHIP, and there's a lot of people don't really, they know of us, but they don't really know what we are.
Exactly.
And executive health has been around for about 20, 25 years. And what it is a lot of companies will send their top executives for a whole once-over, and they're there for the day, and they do a lot of testing, and then they try and find disease and catch it in the early stages, and really focus on preventative health. Right. What our concept was we wanted to bring that to the general population. Yes, executives were getting this level of health care, but the everyday person wasn't. And they were going to maybe their regular family doctor and maybe they're going and getting a physical, maybe it's 20 minutes long. And what we did was we took all the services that were in an executive medical, and we looked at some of them, we said some of them are billable to OHIP, some of them are not billable to OHIP. Let's just charge for the services not covered by OHIP. For example, we have a machine called a BodPod. It's a $50,000 machine. It's space-age technology. And it will give you a lot of details on your basically what your body composition is made up of. That's not covered by OHIP,
right?
So you would pay for that service. So instead of a $2,400 executive medical, our price is only $800, and then if you come back the next year, it drops down to $600.
Okay, so you have a yearly contract with a client, for example?
We have about 60 corporate relationships where companies will send their top executives or their partners to us, and they will pay for the exam. But more than half of our business is just individuals who just want a more comprehensive analysis of what's going on. So our clients will get a 20-page report on exactly, with graphs and exactly a snapshot of where their health status is today.
So it's totally comprehensive. It's not where you're just going to get a blood pressure check or a blood check. It's like from head to toe. And now, can you sort of maybe shape it to what you want to say? I've either challenged with finance or something, and I say, okay, I've got this much money, but I need this much check. Can you have a checklist? Or
we have a couple of services that we sell outside of the comprehensive physical. For example, you could do the BodPod test. We also have mole mapping. So a lot of people are very concerned about skin cancer, and they're not sure how long this mole's been here. They want to be able to track their moles. Mole mapping is included in the executive medical, but you can also get it outside of it, and it will do 14 high-definition pictures of your skin surface, and every time you come back, the software program will tell you whether or not those moles have changed. Yes, you can buy that separately for $100. What we really focus, though, is on the full medical.
Right.
As I said, in Toronto, you're paying anywhere between $1,500 and $2,400 to $2,400 for these, and they are also open to the public. At $800, we really want people to focus at have an affordable medical that is focused on prevention. And these days with our hospitals being overrun, our family doctors are very, very busy. They have to see a lot of patients. You have waiting rooms that sometimes you wait for an hour or 2 hours just to see the doctor for a 5-minute visit. And it's not the doctor's fault that they have to be able to see that many patients in order to make a living. With us, we run on time. You make an appointment. If you're not in within 10 minutes, there's something going wrong.
So the upside is that we all go in and get our car serviced, and the guy said it's $800. So you say, fine, it's $800. I need my car. Well, the most important thing we need is our body. So it's really not bad to have a fee to pay to make sure we're healthy. Because a lot of us, as we get older, and you know, this is a Boomer and Above show, sometimes our health slides and we you know, pop a pill and that helps. We think that helps us, but at the end of the day, we really should look at the cause and how to cure it rather than a pill.
Well, a pill is not going to make you well. A pill is going to reduce the amount of ill that you're going to get. We try not to, you know, in some cases you have to have medication. If someone has very high blood pressure or some other reason, there is a role for medication, but lifestyle can fix so much of that. And a really good example is we have a gentleman who's actually on our website. His name's Bob, and I can talk about him because he's on my website. But here's a gentleman who 1 year ago was on 7 different medications. He was seeing 2 different specialists. He was 40 pounds overweight, and he was pre-diabetic. And he was in decline. And you know, we actually have a video of him talking about his journey. 1 year later, he decided, he said, okay, I get it. I got to make some changes in my life. He's lost 40 pounds. He's no longer diabetic. He doesn't see the 2 specialists, and last month we were so happy we took him off the last of those 7 medications. So if you think about what 7 different medications is going to do to your body long term compared to proper nutrition, proper fitness, a balanced living, and you know, it took a wake-up call for him to get that. Right. And you know, but the difference in his life is incredible. And we have his before and after pictures on the website. Now he's chosen to do fitness training, but a lot of people just they get the results and they say, okay, this is great.
Good. Thank you, Alex. I appreciate you being on the show. I think Medpoint's a great idea, and I hope people call you. Thank you very much for watching Over 55, and we'll see you next week.